Friends, good to be with you. For years, we've been telling people to take omega-3 fish oil supplements for heart health and brain health. But what does the evidence actually show? When it comes to cardiovascular disease, there have been large, high quality, and several randomized controlled clinical trials evaluating the use of fish oil supplements in cardiovascular disease. And trial after trial after trial have failed to show a benefit. There was one exception, which is a trial of 4 grams of pure EPA, which comes in a prescription tablet called Vasipa. This is not something you can buy at Costco over the counter. And they gave Vasipa to patients who were already on a statin and had high triglycerides and were at high risk for heart disease. And in that trial, there was a reduction of cardiovascular events. But that is not applicable to most people. And in fact, the 2026 new lipid guidelines explicitly state that routine use of fish oil supplements for cardiovascular disease is not recommended. What about brain health? So there's EPA, which is supposed to be good for the heart, and there's DHA, which is supposed to be good for the brain. There's lots of DHA in the brain, and so the thought is eating DHA might help with brain health, cognitive function, reducing risk of dementia. A lot of that comes from observational studies in which people who ate more fish appeared to have lower rates of dementia. But as we know, observational studies are really hard to determine cause and effect because they have a lot of confounding variables. We don't know if it was the salmon that people were eating that led to less risk of dementia or other healthy behaviors such as exercising, not smoking, or other things that they were eating. It's so hard to tease that out, even with fancy statistics. So what observational studies are good for doing is generating ideas and hypotheses that you then do a randomized controlled trial to test. And when we've done that for brain health, the results are very mixed, with some studies showing no benefit to cognition and no benefit to progression of dementia or development of dementia. So if you are taking omega-3 fish oils for heart or brain health, just know, and you think, that the evidence supporting their use for those indications is much weaker than you think. Thank you for listening, and if you like my content, please subscribe.